Today, we are diving deep into one of the most common and honestly, one of the most fascinating drugs in all of modern medicine, Propofol. You'll find it everywhere from the operating room to outpatient clinics, and it has totally changed the game for sedation. So let's get right into it.
Milk of amnesia. It's a pretty wild nickname, isn't it? But that's what some people call the powerful anesthetic we're talking about today. And it makes sense. Its milky white look is completely unmistakable, and its effects are so profound that it's become a real cornerstone of modern medicine.
So, what is this stuff really? Scientifically, Propofol is a diisopropylphenyl intravenous hypnotic agent. Okay, I know, that's a total mouthful, but the key word to focus on here is hypnotic. At its core, it's a drug designed to put you into a state of unconsciousness and to do it really quickly. So how does it pull that off? Well, the magic is all in how it interacts with our brain chemistry. Propofol works by giving a huge boost to GABA, which is basically the brain's main off switch. By making that inhibitory neurotransmitter way more powerful, it essentially just calms the whole central nervous system down, leading to sedation and anesthesia. Okay, so we know what it does, but how it does it so incredibly well comes down to the way it moves through the body. This is something we call pharmacokinetics, and with Propofol, it's a journey that happens at like lightning speed. Yeah, you can really think of it as a sprint. The second it's injected, Propofol wastes zero time. Because it's what we call highly lipid soluble, meaning it loves fat, it can cross the blood-brain barrier almost instantly. But, and this is key, just as quickly as it gets into the brain, it starts moving back out, redistributing to other tissues like your muscles and fat. This super fast in and out action is exactly what makes it so controllable.
Now here's the really fascinating part. This is why patients wake up so fast. It's not because the body has gotten rid of the drug. Not at all. It's because the concentration in the brain drops like a rock, simply because the Propofol has moved on to hang out in other parts of the body. This initial distribution half-life is incredibly short. We're talking just 2 to 8 minutes.
And that rapid redistribution leads directly to its #1 benefit. Patients tend to wake up feeling remarkably clear-headed, without that awful grogginess or hangover feeling you get from older anesthetic drugs. This clean, quick recovery is precisely why it's the go-to for outpatient surgeries where people need to be able to go home the same day. But Propofol's journey doesn't just stop at the brain. While it's creating that state of unconsciousness, it's also having some really powerful effects on the entire body. So let's take a look at what those are. The biggest effect on the cardiovascular system is a drop in blood pressure. This happens because Propofol causes vasodilation, which is just a fancy way of saying it makes your blood vessels wider. As you can see right here on the chart, that drop is pretty significant. It's more than double the effect of an older drug like thiopentol. This is something anesthesiologists are watching like a hawk. Right along with that drop in blood pressure, Propofol has a major effect on your breathing. It's what we call a profound respiratory depressant, which means it seriously slows down your body's natural drive to breathe. This is a critical reason why it can only be given by highly trained professionals who have airway support ready to go at a moment's notice. And just to put that into perspective, look at this number. There is a 40% chance that a standard induction dose, that first dose to put someone to sleep, will cause apnea. That's a temporary but complete stop in breathing. It just goes to show you how incredibly potent this drug is. But it's not all about depressing the body's functions. Up in the brain, Propofol actually has some uniquely awesome effects. It lowers blood flow in the brain and reduces intracranial pressure, which can be a huge help in neurosurgery. Plus, it has these built-in anticonvulsant and anti-nausea properties. So it helps prevent seizures and nausea, which, let's be honest, are two very welcome side effects. So when you put this all together, you really start to see Propofol for what it is, a true double-edged sword. On one side, you've got these incredible benefits. It fights nausea, seizures, and even itching, all while giving you that clean, hangover-free recovery. But on the other side, you've got some very serious risks that have to be managed. A big drop in blood pressure, severe respiratory depression, and yeah, it can hurt when it's injected. And that brings us to our final section. How is this incredibly powerful tool actually used out in the real world, and what are the critical cautions that every single clinician has to respect? Given everything we've talked about, it's no surprise that Propofol is super versatile. It's the #1 choice for starting anesthesia and for conscious sedation during procedures like endoscopies. It can also be run as a continuous drip to keep someone under, a technique called TIVA, and can even be used in teeny tiny doses just to stop someone from feeling sick. All right, let's talk about those critical cautions. And one of the most unusual risks comes from the way it's made. That milky white liquid is a lipid emulsion, which is basically a fatty substance. Unfortunately, that can be a perfect breeding ground for bacteria. This means that anyone handling Propofol has to use absolutely strict sterile technique to prevent a really catastrophic infection. But the most feared complication, without a doubt, is Propofol infusion syndrome. It's rare, thank goodness, but it's a devastating condition that can happen with long-term, high-dose infusions, especially in children. It triggers this cascade of organ failure, metabolic problems, heart issues, and it has a very high mortality rate. This is the single biggest reason for extreme caution when using it for pediatric sedation.
So, tying all this together, there are some very clear situations where Propofol is just the wrong drug for the job. An allergy, obviously, that's a no-brainer. But more critically, you can't use it in patients who absolutely cannot tolerate a drop in blood pressure, like someone with severe heart valve disease. And, as we just covered, it's contraindicated for sedation in kids because of that infusion syndrome risk.
So we're left with this paradox, right? An almost perfect anesthetic that also carries these profound risks. A fast, clean recovery on one hand, and the potential for serious heart and breathing problems on the other. It really leaves us with a final question. How does modern medicine manage this daily balancing act? Well, it's a true testament to the incredible skill and constant vigilance of anesthesia providers everywhere.